Welcome back. This is the next episode in our WBL collaboration, and this week's inspiring woman is Tesha Montgomery. She started her career as a nurse, and that means today, where she's a senior executive responsible for patient access, she never forgets why she's doing what she's doing. And her job, it's all about transformation and innovation. And she loves it. You'll hear about her career journey and how she's learned to run her own race, as well as making sure that everyone else's priority no longer needs to be her priority. How she learned that and other advice from Tesha you can hear in this episode. Please subscribe to hear more every week. Incredible women. But now let's hear from Tesha. This is Inspiring Women, and I'm Laurie McGraw. I'm here at the WBL Summit in Amelia Island, and I'm excited to be speaking to a number of the prominent members of the WBL community, and one of them is with me today. That's Tesha Montgomery, and she is a Senior Vice President at Houston Methodist, where she is responsible for system patient access. And Tesha, I'm delighted to be speaking with you.
Thank you so much, Laurie. I'm delighted to be here.
Okay, we're going to get going. And so Tesha, you've been in healthcare for a bit now in senior level positions, chief operating officer. You're involved in innovation. You are from the Ohio State University, as we have established. And maybe give us a little bit of your bio sketch, and then we'll talk a little bit about what you do day to day at Houston Methodist.
Absolutely. Thank you so much again, Laurie. So my background, it has always been healthcare. Believe it or not, I've been in healthcare now for over 20 years, been in leadership for 20 years.
You don't look it.
Thank you. So yes, I'm from Ohio, hence my background with the Ohio State University. I was raised in Youngstown, went to nursing school at Ohio State, and also went to graduate school at Ohio State and got my MHA. While I was in nursing school, I worked all through school. And so I started in healthcare, working as a unit clerk. I worked as a unit clerk.
Was that at the VA where you were the nurse at the VA?
It was before that. I was at the James Cancer Hospital, Ohio State's James Cancer Hospital, as a unit clerk.
Oh, wow.
Then became a PCA, and I worked on a hematology oncology unit and saw everything. The sides of healthcare, we did everything back then. So I was with the patients doing, you name it. And because of the type of unit I was on, was there with them even in death. So that showed me a whole, just that side of healthcare. I did all that while I was in nursing school, and then started working for the VA in Columbus, Ohio. And I stayed at the VA when I became a registered nurse. So I worked for the VA in primary care, went to grad school as well at the same time for my MHA. And after I graduated, I went to Minnesota. I moved from Ohio to Rochester, Minnesota.
Oh, my goodness.
And worked at Mayo Clinic. I was an administrative fellow at Mayo Clinic and stayed there for 11 years and various capacities and leadership roles over my time there. Before moving to Houston in 2014, I was with another large healthcare system, overseeing the operations for their ACO, Accountable Care Organization and Physician Network, and then transitioned to Houston Methodist in 2018. I started as the vice president for operations and patient access for the physician organization. We have over 1,000 employed physicians.
Large organization.
Yes, several different storefront locations. And 4 months ago, I started my new role as senior vice president for patient access for the system. So I took half of my job with the physician organization, kept that, and then expanded it system-wide.
Well, congratulations. I mean, what a storied career. So, I think with in healthcare today, we know that there's just like so much cost, and we're past the 4 trillion mark. We're headed towards 5 trillion in spend. And a lot of that heavy cost comes from administrative costs. And I think that for senior executives like yourself to have sort of like been there, done that, and grown up on the clinical side so that you can really see what patient care delivery looks like. I have to believe that is so impactful for you in your executive position in Houston. I'm just imagining that's a tremendous asset for you.
Yes, absolutely. It's given me a completely different perspective that I think I would not have otherwise had if I had not worked on the clinical side for so long, and just being able to see why we do what we do. I think sometimes in administration and when we get to certain levels, I think we all have the right intentions. We all have the right motives, but sometimes you can get disconnected,
Yeah.
and it's easy to forget why we do what we do. And so being with the patients and the capacity that I've been able to work with them, it really helps to keep it in perspective.
So what is your new senior vice president, role? So it's everything that you used to do plus a whole lot more. So what does day to day look like?
Day to day is different every single day. So really my new job is really around making our system the most accessible system in Houston.
Okay.
That's what my job is with patient access. It's really looking at the patient experience before they even hit our doors,
Mhm.
whether they hit our physical doors or whether they connect with us virtually. But what is that whole experience like? Really breaking down barriers, looking at our workflows, looking at digital innovation and technology, and really transforming how patients can connect with us and make it easy and seamless. And Laurie, I know you know this. Today we get everything on demand,
Yeah.
right? We get our banking on demand, we Netflix on demand,
Yep.
everything. I can get groceries delivered to me, Amazon, Uber, you name it. And so now those same demands people expect for healthcare.
Yeah.
No longer are the days where they want to wait, 3 weeks to see their doctor. Then I have to drive 20 miles to get there. They're not doing that anymore. And so, I see my role as how can we continue to transform that and really make it easy for patients to get into our services and meet that same level of expectation that they have in every other aspect of their lives.
So how are you doing that? Because I mean, one of the things that we know, so you grew up in multiple healthcare systems. You know how complex they are, and you also know they're a little bit dated in terms of innovation is a different beast, and now you are up against the Amazons of the world, the One Medicals, and the like. So the pace of expectation, like you're talking about in terms of the patients, we do want it all to be easy, but you also know better than anyone probably how complicated it can be. And I know that you're responsible for innovation in addition to patient access. You're on the Innovation Council or whatever
Yes.
that senior leadership group is at Houston Methodist. So how does innovation get embedded? How do you evaluate how you can actually take what is a lot of great ideas out there and actually implement them within your health system?
Great question, Laurie. So innovation, especially at Houston Methodist, is something that I am extremely excited about because I've seen it done differently there.
Mhm.
So innovation at our organization, honestly, it started as a book club. Okay,
Mhm.
it started as a book club. So our Center for Innovation began about 5 years ago. And it started as a journal club. It was just a group of people that got together that were very interested in digital technology.
Mhm.
And, they would get together and you talk about articles, share articles over emails or what have you. I joined the organization around that time that group was getting started. And so they called themselves DIOP, which stands for Digital Innovation Obsessed People.
Okay.
And the name stuck, right?
And
So
you were
that's
just like, I need to belong to you.
yes, sign me up. I'm obsessed. And so when I joined the organization in 2018, I became a part of this DIOP group.
Uh-huh.
And that's what became our Center for Innovation.
Mhm.
And so we do have a Chief Innovation Officer, Roberta Schwartz, and who leads the group. However, the unique thing about this group is our Chief Innovation Officer is also the CEO of our flagship hospital.
Oh.
And so all of the members of our innovation team, we're operators too.
Right.
And so it's not a separate unit. So often we see organizations that have a completely separate innovation group.
Right.
And then when you try to execute those ideas into operations, you sometimes run into a lot of resistance.
Well,
or it just
also,
doesn't
it's like
work.
it's one of those things. I mean, and the number of people who are in type of innovation roles that are, separate almost as like a strategic project, right? I mean, those when there are budget constraints, perhaps those often are the things that are less invested in. So, what a great model,
Absolutely.
Opportunity for actual implementation of some of these ideas.
Absolutely. It's worked very well. So we have an interdisciplinary group that all comes together. And so we have the operators, we have hospital operators, we have physician organization operators, we have HR at the table, we have legal at the table.
Yeah.
So we can get through those contracts more quickly.
Yeah.
We have IT at the table, you name it. And so we have the right representatives, revenue cycle. So everybody's at that table together. And so as we come across these ideas, we're basically, we're doing it to ourselves.
Yeah.
Right. We're doing it to ourselves, and you get the buy-in, and you're able to have the speed to execute more quickly than I think you would otherwise.
Okay, well, I'm rooting for you because I mean, there's nothing like innovation that's needed in healthcare, and you're in an area, Houston, diverse population, very spread out, although concentrated in some areas. So a lot of people to serve. Okay, Tesha, let's come back to you a little bit. So we're at the WBL conference, and we've got 300 people here in beautiful Amelia Island. A lot of networking going on of senior executive women. Why did you join WBL? Why is it important to you?
So I joined WBL right at the point when I transitioned from Mayo Clinic and moved to Houston. And so when I started my COO role overseeing the physician network and the physician network, one of my mentors from Mayo Clinic, our former chief administrative officer, Shirley Weiss, she actually nominated me and told me about WBL and said, okay, now, Tesha, you're at this level that you should be a part of this group. And so she told me about the organization. She nominated me, and I came to my first summit and attended with her. And she showed me the ropes and connected me with a lot of great women. And that first summit that I came to, it just felt different. I don't know how else to describe it. I've gone, again, I've been in healthcare for years. I've gone to several conferences, but this conference was different. It really felt genuine. There was just a lot of women coming together, helping each other. And even some of the sessions that we had, the networking sessions where we have the table talks, and, you'd have the various questions that you flip over and people talk about. You can actually get real problem solved, right? You can literally talk at the table around challenges that you're facing, or if you have investors at the table, you have so many people around that are so well connected. And again, everyone just had a genuine interest in helping each other.
Yeah.
And so I just love the vibe that I got from WBL. And once I came to that first summit, I was sold. And so I've remained a member, since, what was that, maybe 2014, 2015, around that time. And this has been a great organization.
Yeah, I'll tell you, it's like I personally, similar thing, didn't know about WBL until somebody who I brought on to my team said, we need to be a sponsor. I'm like, absolutely. What are we talking about? It's like the best kept secret. So let's talk about just in your career. So having all these different senior level positions and now moving up to the executive suite, what's been the secret? So we're going to talk about obstacles, and I'm sure you've got plenty of things that you've had to address along the way in terms of things you've had to face and then conquer. But what's been important to you? Are you thoughtful about your career and always sort of looking for the next thing? Is it mentors? Is it something that just like, this is always what you wanted to be? What is your secret sauce for being the executive you are today?
Prayer, lots of prayer.
Faith is important.
Yeah, lots of prayer and favor. Divine intervention. That's my So in addition to all of that, what I would say is, you have to execute. You have to execute. At the end of the day, I see it's the results, that matter, and building the relationships. You have to have good relationships, build good connections, have integrity, be a woman of your word. And, when you execute, you have those good relationships and people can see the results. I think that's how I've been able to navigate up to the level where I'm at today.
Yes, but I'm going to push on you a little bit.
Push on me, Laurie.
So every senior executive has accomplishments sort of under their belt, but as a woman, as a Black woman, there are other things that you are dealing with where people have expectations of perhaps you're not right for something, or you're not going to be as excellent at what you're doing. Have you experienced that? If you've experienced it, how have you overcome it?
So I would say, what I have experienced is probably the feeling of I have to work harder than other people in the room in order to get that same level of respect or that same level of advancement. And sometimes I would say that could be a perception. And sometimes it could be real. But the reality is when you are, the only one at the table, whether it's the only woman, the only African-American, I do think sometimes there are some unconscious bias that can come to that, that can come with that. Everyone maybe not intentionally, but they're there sometimes. And so I think I have had to deal with, well, I probably couldn't get away with the same things that some of my peers can get away with, right? I probably couldn't say that and get away with it, right? They look differently upon me if I said those same things. And so I think just really, overcoming some of those internal, you kind of, sense that on the inside.
Yeah.
And then really trying to overcome those mental battles that's going through your mind, as you're going through all of this. And so I say that's what I have experienced. And again, for me, the ability to overcome it has just been knowing who I am. And I think when you know your self-worth, when you know your value, then you realize you don't have to compromise for anyone else. I can run my race. And once I understood my value, I knew what I could bring to the table. Then it didn't matter to me what promotion somebody else got. It didn't matter, oh my goodness, are they going to steal my spot? What's for me is for me, and I know what I can bring to the table. And so it was just, I think, learning, and I'll say this, learning to maximize the moment. Maximize the moment that you're in. Not to say that you shouldn't look for, you're always kind of thinking ahead. What else should I be doing? How else can I be improving? So you always have that, and you can always have that in the back of your mind, and you're trying to think of how can I make myself better constantly. But you also have to realize, how do I maximize this space that I'm in right now?
So give us an example, because I think those are like really, really true statements in terms of what you're saying. But I also know, even from myself and so many women that I talk to, the sort of like being inside your head and letting those doubts fester, that can be an obstacle. And so then having a way to sort of shake yourself out of it, or having the confidence. How have you done that? Like, what has allowed you, maybe in that maximizing a moment, perhaps, to be able to do that? Because I think that many women sort of stay in the head, and don't take the opportunity that might be available to them.
Right. Well, I can't say that I've always done it 100%, right? The way that I think I could have, right? When you look back, there are times where you don't speak up. There are times where you don't feel like I don't feel like I should be at this table with everyone else, right? I don't feel like that I'm at that same level. And so you do shy away, or I don't feel like I'm qualified for this job, and so maybe you don't throw your hat in. And I think how have I been able to get over that? Just really taking a step back and recognizing, like, why not? Right? Like, why not? Right? Like, I can do this. I know what I can bring to the table again. And sometimes, like I said, you miss those opportunities. I can't say that I've done everything 100% correct throughout my career, because I certainly have not. But then you learn from that. When you kick yourself, or you kind of like, oh my goodness, I missed that, or why didn't I do that? You learn from that, and you kind of self-correct from those moments, and then, go for it. I wouldn't be in Houston if I wouldn't have gone for it, right? When I applied for the job that I came here for, I didn't, a chief operating officer, like, could I really do that? Should I do that? But if I didn't make that leap and just, go for it, I wouldn't be where I'm at today. And so I think you have to learn to overcome those thoughts that try to hold you back.
Yep. Well, another thing that I know from speaking with lots of senior executive women, is sort of like the learning never stops. And it's almost like it becomes more important the more seasoned and senior you are. So just assuming that is true for you, what are you learning that excites you these days, that keeps you inspired about the work that you're doing?
So yes, constantly learning. That's always learning and improving. And honestly, Laurie, coming to WBL is a part of learning, I would say. Taking the time to invest in yourself. As a senior leader, we care for so many other people, right? You have so many staff underneath you. You have layers of leaders underneath you. You're juggling family, husband, kids. There's a lot of things even outside of work that you're juggling, and people that you are taking care of. And so often we don't take care of ourselves. So I think learning to take care of myself at this level is really inspiring, right? And it's learning that I can do that and still be successful. It's learning that I'm able to do that,
right?
And I'm still able to balance. I can still be effective and still do self-care.
Yeah.
And I think I didn't realize that earlier on in my career. You always kind of feel like you have something to prove.
Yeah.
So you're always, let me prove this. So everyone's priority became my priority.
Yeah.
And I was, yes, I can do it. And I've learned now over the years, as I've become more seasoned and more experienced, No,
Yeah.
everyone's priority is not my priority. And it's not always yes, but let me tell you what I can do.
Yeah.
And you have to learn how to set those appropriate boundaries. And again, take time for yourself. And as I said before, coming to WBL is one of these moments where women can invest in themselves.
Yep. Yeah. Well, that is incredible. And I think also, you talk about like where you started, where you sort of, you didn't say this exactly, but I'm taking it as I outworked. I did more, and that's what I did. And it mattered. And now recognizing that you don't have to sort of give up on not giving yourself the space to take care of very important things like yourself. So that is fantastic. Tesha, as we close out on this Inspiring Women conversation, just as you have done so much, you are a very senior vice president at Houston Methodist. If you were to look back when you started and just give your 20-year-old self advice, what would you say for other sort of younger listeners who want to be you when they grow up?
Oh my goodness, those who want to be me. Wow. So as I would look back, go back 20 or so years ago and talk to my younger self or talk to young careers that want to make it up the rank right now, I think the things that I would say is, again, know yourself and know your worth, right? Understand who you are, know what you're capable of, and don't let people limit you. I think we allow people to put us in a box, whether it's because of our past experiences, where we've come from, or even the types of jobs that we've had in the past. Sometimes people try to box you in, just to that one particular area that you may have worked in for a few years. And so I'd say, don't put limits on yourself, and it's a whole big world out here. And you always don't have to have things so mapped out. Now, planning is important. I'm not saying anything against planning, but what I am saying is, don't limit yourself. There are so many opportunities. There are so many opportunities to be a leader, to grow in your career. And just keep an open mind. Don't let people limit you. If you want to go for it, go for it. If you don't get it, get the feedback and adjust. Learn how to take feedback, constructive criticism without being defensive, right? And self-correct and go for it again. That would be the advice I would give.
Well, I think that's great advice. And this has been such a great Inspiring Women conversation. I think that, that advice to your 20-year-old self is probably something that will play it forward. So congratulations again on the Senior Vice President promotion. I'm confident it won't be the last one that you ever receive. I've been speaking with Tesha Montgomery, and Tesha, thank you so much.
Thank you so much, Laurie.
This has been an episode of Inspiring Women with Laurie McGraw. Please subscribe, rate, and review. We are produced by Kate Cruz at Executive Podcast Solutions. More episodes can be found on inspiringwomen.show. I am Laurie McGraw, and thank you for listening.